Gentlemen, welcome to this week's episode of What the Health Just Happened, where we talk about all things healthcare, community, business, and life. The goods, the bads, the ups, the downs, the lefts, the rights, and everything in between. We also bring on a variety of pretty cool guests that are way smarter than we are to talk about all things healthy versus not healthy and whatever topic comes up. Today, I am thrilled for today. I am a University of North Florida graduate. Can I get a swoop?
Swoop.
We have two representatives from the University of North Florida. I'm going to let them introduce themselves a little bit. But one, the Director of Community Engagement for the University of North Florida, Dr. Paryani, and the Interim Dean for the UNF Brooks College of Health, Dr. Zhao. Welcome to What the Health Just Happened. How are you doing? Oh, that's good.
Yeah, we're excited.
Thank you so much, Eric, and very nice to be here.
All right. You ready to have some fun?
We are.
Sure.
We are, absolutely.
Yes.
So you, why don't you go first? What's your
Sure.
role? How long you been in that role?
And so I'm Shyam Paryani. I'm a physician by trade. So I was an oncologist for many years, and I ran a large company of many physicians. So I decided that I was a great doctor, but I was a terrible administrator because I had to manage these all these doctors. And managing doctors is like herding cats. So I went and talked to Pam Challey. You probably know she was the dean at that time and became our president for a year. Pam said, if you really want to manage physicians, you need to have a master's in health administration. So I said, do you have a program in that? She said, of course we do. And you need to take it. And so I started the program and I graduated from UNF. So I'm a UNF alum.
Swoop.
In about 2000. And I continued to practice and ran my large company, sold it off, and decided to have fun again.
Oh, that's great.
And the fun was coming back to UNF.
Do you feel younger working at UNF? Like you just got
Absolutely.
reinvigorated with youth?
Absolutely. It seems like the students are getting older and I'm getting younger.
All
that's
right. Even
Because
better.
I train mostly graduate students, so many of them are in their mid-career.
Okay.
So not the youngsters and the undergraduate. So many of them are actually in a somewhat contemporary, because we're doing similar kind of problems. So I feel young again.
Let's talk about the Brooks College of Health specifically, because we do have the interim dean here. You run the show.
Yes, thank you.
All right.
She's the boss.
She's the boss. That's right. What
Thank
about
you.
yourself?
the boss lady.
What are the roles of the boss? Like, what on a day-to-day, what is the interim dean responsible for?
Very good question. And before I answer your question, I also want to say thank you, Dr. Paryani. And Dr. Paryani has been helping me personally and our college and before our department a lot, significantly. So that's why I really appreciate all his great work with us. So he mentioned that he has been very successful not only as a physician but also as a business leader before. But we want to see, he got a lot of degrees from other universities, but we would always love to tell him all your biggest successes because of UNF's Master of Health Administration degree.
It's absolutely true.
Yes. And I think we are very glad that after he retires from his physician work and then he came back to UNF to help us. First help the Department of Health Administration when I was the department chair there for 6 years, and then now help our Brooks College of Health as our community engagement director. So we really appreciate his leadership.
He's pretty
So
awesome.
see that.
Let's
I
talk
know
about how
he is.
awesome you are.
Well,
Yeah.
yes, I'm pretty good at bragging about my own people, but not myself. Well, my background is healthcare services administration. So before I took this interim dean role, I was a department chair for 6 years, also at UNF, called the Department of Health Administration, where we hired Dr. Paryani when he was ready to come back to UNF. So that's why we always work together in the same field. And our Department of Health Administration become the best department on campus.
Yeah.
So,
No doubt about that.
Yes. So we were the program that ranked by the U.S. News and World Report the top 100 programs in this country and the world. So that's why we're very proud of that. And now, as the interim dean of the Brooks College of Health, I'm supervising 6 different majors, different schools and departments. One, of course, is the Department of Health Administration I just mentioned. Another one is Department of Public Health. Then another one is Department of Nutrition and Dietetics. Then another one is Department of Applied and Movement Science. That includes the athletic training, exercise science, and then we have another department called Department of Physical Therapy. and then a school of nursing. So
How many? Well, actually, first I want to see if they can say the term dietetics. Can you say that? That's a tough word to say.
Dietetics.
Did we say it right? Dietetics.
very
You did.
good.
You
You
did.
got
Don't
an A+.
ask me to spell it, though.
So-
What is it though?
Do you know how to eat?
Yeah, I'm good at that.
And you don't want to diet. So
Let me pause before because I do
So
want to
I
dive
need
in on the specific programs. But I pulled this from the website. What's the mission of the Brooks College of Health? To develop diverse healthcare professionals dedicated to enhancing the well-being of our local, national, and global communities. I love that. So it's not just about Northeast Florida.
Yes.
Total students right now in the Brooks College of Health. Do you know approximately how many students are in it?
Yes, we have more than 3,000 students, including graduate students and undergraduate students.
Is there any one or two programs that maybe have more enrollments or are more popular than others?
Good question. Well, when most of the high school students want to come to UNF's Brooks College Health, what is the one major they want to start? Nursing.
I was gonna
Yes.
say, probably.
So that's why most of the students, high school students and their parents, they would choose nursing. But what they don't know is public health, health administration or healthcare management, nutrition and dietetics, physical therapy, athletic training. So all the other majors. So that's why I'm here to tell the parents and the high schoolers that we do have a lot of allied health professionals, not only nursing. Of course, our nursing is great.
Great.
So,
Go ahead, Trey.
Hey, I got a question. So out of the 3,000, how many are international students by chance?
very good question. In fact, right now, I think the entire UNF is having less than 2%, 2 to 3% of international students, but we're changing that.
Okay.
Because our new president's strategic goal is to increase significantly the international students. I
Nice.
think our goal is to 5 to 10%. So
Okay.
that is a huge jump. And for our college alone this year, we're focusing on the Master of Science in Health Informatics.
Ooh, that's a
That
big
one is a STEM degree, so would be very attractive to international students because they do have the 3-year, we call it OPT, after they graduate. So they could work for 3 years without a working visa. So that is one program we are focusing on this
That's
year
pretty cool.
from this college.
I was not aware of that.
I was going to say, I want to mention a couple of things. You said it. So all you practicing physicians out there or nurses or any degree, go back and get your master's in healthcare administration.
So I think the question becomes as you get further in your career, many people don't want to do clinical 100%, and so you want to transition to leadership. And so part of that, what you're going to do is you need leadership training. And so health administration is where we train leaders in healthcare. So if you look at all the CEOs, the COOs, the C-suite people in healthcare, generally they're going to have a master in health administration degree.
I think it's a requirement now. If you look at all the local hospitals.
Pretty much, yeah. So there was an older school, trained by experience,
Yeah.
trained by fire. But really, the modern era of training is that if you are in leadership at any level, and you're going to start off, generally you're not going to start off as CEO the first time, right? First day. So you're going to need a little bit of experience. So as you go along to the department level and heading departments and divisions and then move up the chain, you're going to start with an MHA first. So you're going to need an MHA even at a lower leadership level.
The Masters in Science Health Informatics, did I get that right?
Yes.
Yeah.
Is that already exist or that's almost...
Already exist. Started last fall 2023.
So that, again, I assume that's going to be a sector that's exploding, right? Anything in informatics.
Yes, it is exploding. So that's why the previous one, we only had the online version is because we are trying to help the working professional that they do not have time to come to a face-to-face class every day. So they could take 90% of those online courses. But because the international students, because of the visa, so we are adding the face-to-face session starting fall 2025.
Love face-to-face.
Yes.
So this fall's
fall, yeah.
happening. I'm like,
Yes,
again, everything blurs
yeah.
together. Next fall, they're
Yes.
starting face-to-face. That's great.
Exactly, yes. And
Well, you'll have both options. You'll have
both options,
online or face-to-face. You can choose, basically.
you can choose
either one.
any one. Yes.
This is a bit of a pivot here. You've been there long enough. I guess you both have. Did you notice a massive spike in students that preferred remote school versus in person?
Yeah, I think COVID was a turning point. I think everybody, the university closed down for months, for several months. And so we went to Zoom, and we all learned what Zoom is all about. And then we also learned how to teach on Zoom. So the professors also pivoted to teaching on Zoom and teaching remotely. So we figured that system out during that period. And then, when COVID kind of gradually brought people back into physical facilities and you're allowed to, mingle, if you would, in crowds, the classrooms came back. But we also discovered we could still do remote too. It didn't make it completely go away. Just as remote work. A lot of people don't want to go to work in a regular, workplace environment. They want to work remotely. Same thing with education. We've kind of got a balance of the two. So there are some people who just rather do it remotely online. And I think that segment is going to continue to grow. It grew, obviously was 100% during COVID and then went back to face-to-face primarily, which most of our classes are still face-to-face on campus. But I think the online segment as an option, as an alternative face-to-face, I think will continue to grow.
To help the working health professionals. Right. For example, we developed a lot of new online programs for the nursing, the graduate and doctor nursing programs, because those students, they are already middle-level hospital managers, and they do have the full-time day job and shift work.
Yep.
But with the online, they could learn the leadership, like the doctor nursing leadership. And then a lot of our students already become hospital chief nursing officer. So they do need, on top of the clinical skills, they do need the leadership skills, which they could get from the online courses and online programs. The same thing with nutrition and dietetics. We also developed the doctor of nutrition.
Dietetics. Exactly. I'm going to keep saying that word over and over. Cool.
And what I did want to ask, and you might have just answered it there, but in my mind, nursing and some of those things, do involve a little bit of hands-on, but because have you found some workarounds in those places, or is these specific classes not necessarily needing that?
Good question, because all these online courses we develop are for the upper graduate level. All their hands-on courses are already learned from their undergraduate courses.
Okay. So you have to be a nurse first, right?
Exactly.
So you have to be able to take care of patients, right?
Then become a nurse manager.
That makes it a little bit easier. I get that.
So it's more advancing their career in a different level. As I mentioned, many people want to transition. Especially nurses, I think it's hard work.
It's a grind.
Eric, we don't have to tell you that, right? You're an example of that, right? So it's a really hard work
to leave the bedside care. You eventually get burnt out on
right.
it. And then this is an opportunity to move up the corporate ladder.
Yes.
Right. Use that term.
And you can still be doing part-time clinical medicine. So if you love taking care of patients, many people do part-time clinical work and part-time administrative work. That's what I did. For many years, I never gave my clinical practice up. While I was still leading this large group, one day a week I still had clinic. So taking care of patients was still my prime directive. That's what I was trained to do, and that's what I love to do.
When you weren't hurting cats, we're going to go back to that. That's what you said running physicians were. So as the interim dean, I'll just like this question, what's a win or what's success? Are you measuring graduations, number of new students, new programs that are started? Like when you, at the end of the year, January 1st of 25, and you look back on 24, you think, we did a great job. What does that look like?
Well, I think from your perspective, you already answered some of those questions. So in general, what is the win or success being an interim dean or dean of Brooks College of Health? I think number one, student success. We want each and every one of our students to graduate, to find a job, to find a better job. So that's the number one. Number two, we also want our students, when they are in our college on campus, they could have the best experience. They could do research they want to do. They could do the internship, the hands-on experience, study abroad programs. So number one, student success. So from when they are in the program until they graduate, find a good job. So that is my number one success as a dean. And the number two, I want all my faculty and staff to be successful. So that means they are going to be a good educator, teaching. They are going to be good at scholarship, research, and also they're going to be good at service. So we want to provide service to the community, not only educate our students, but also provide service directly to the community, like our public health faculty and staff members. Right now, UNF is partnering with City of Jacksonville for the HIV, eliminate HIV in 2030.
Right.
So
HIV, the infection.
The fast track.
Yeah.
Yes,
So the idea is how can UNF help partner with the city to make sure that the goals are achieved, and so we lend support on not only our staffing and our nursing that comes out in the community, but on an educational and research basis, so we can help them track those statistics and data analysis. So we're great partners with the city, and the city's been a great partner with us.
Let's go back to staff.
Yeah.
Sorry, go ahead.
Oh, go ahead. I think I talked about student success, faculty and staff success, and now is the community partnership. So we mentioned a little bit. Yeah. So that's why we have you guys, and we invite Eric to serve on our health administration advisory board. So this is the community partnership we're doing. We're partnering with the major healthcare organizations locally, Mayo Clinic, Baptist, St. Vincent, Florida Blue, all the major healthcare organizations. And we try to invite their leaders to serve on my Dean's Council, on each department advisory board. So help us identify what are the needs of the community that UNF's Brooks College Health can help to develop the talents or to meet the needs of the community. So that's the community partnership. And then, of course, as a dean, I also need to oversee the budget and all the personnel. Hiring the people, yes. And, the day-to-day operations, and also provide the academic leadership. So monthly we have meetings with the provost, the president, and to look at how our college, Brooks College Health, can help the university achieve the strategic goal. One goal for the next several years would be to grow from the current 17,000 students to 25,000 students for the whole university.
That's a big jump.
And I know that's almost a 50% jump in 4 years. So that's why our college so far is the best one, because last year we grew almost 10% about the enrolled credits. So that's why now the president provost really wants us to use us as a role model. Of course, I have a lot of pressures because next 4 years, every year I have to grow 10% to make the 50% goal.
Pressure makes diamonds, right? Isn't that a quote?
But healthcare is where it's at. Really, because we're all going to need healthcare.
It's never going away.
And there's going to be need for healthcare workers.
Massive
and staff.
shortages.
Yes, and we got shortages of nurses and all of their allied health, doctors, every profession in health. So I think I believe it'll be easier for us to attract those and grow that growth.
It's a great school. It's a great city.
Yes.
It's a great community. There's a great dean. There's a great director of community engagement. Go ahead, Trey.
Do you guys have a rough number on job placement out of
that was a question I was going to ask. So
very
part of that
good.
as a graduate, you're
Very
helping
good.
with job.
Yeah, I can see our health administration.
So I can talk about my program, 100%.
Hey,
100%.
So
parents
I'm a
that,
graduate
baby.
program, but many of mine are already working. My idea is to even advance them to another level. So, but 100% are employed, and they're employed at a higher level than they started. So that's our goal. Is by the end of time they graduate, they have the degree, they can qualify for the next level, because that gives them another qualification and experience to do that.
I immediately go to nursing because that's my background. But you look at this list, right? Clinical and applied movement sciences, health administration, nursing, nutrition, and dietetics. Did I get it right?
Yes, very well.
Physical therapy, public health. I'd like to keep saying those because there's multiple programs.
Yes.
So all of these departments, are you trying to help as people graduate, setting up interviews, internships, letters of recommendation? I mean, I assume that's part of the responsibilities for all the faculty.
Well, nursing is a great example because I think every nursing student that comes out usually has multiple offers. As we know, the need is there, so it's really not a big issue to to get them a job is getting the right position.
Yep.
Letting a nurse graduate decide,
Yeah.
do they want to be a hospital, they want to be outpatient, they want to be a travel nurse, or what they want. Yeah,
Night shift.
that's true.
Was it mandatory you would get that?
So
If you're coming out of college with a nursing degree, there's a good chance.
Especially in a hospital setting, they're going to put you on shift.
You got to earn your stripes.
Sorry.
and also I think that's why the state, Florida, is giving a lot of funding to support the nursing education. The past several years, UNF School of Nursing also received a lot of those pipeline funding to add almost double our faculty numbers. And then we kept getting line funding. Those are for the nursing students' scholarships and helping whatever area in nursing that needed. So like this year alone, we got support from Mayo Clinic and HCA. It both gave us total about $700,000. Then we got matched $700,000 from the state. And then altogether, our nursing anesthesiology program got $1.42 million.
Let's go.
So that is a lot of support. And the money will go a big part of the money will go to student scholarships. We call them Mayo Fellows and also HCE Fellows. So that's, you can imagine all the nursing students, like Dr. Paryani mentioned, they are not only going to get a job, but multiple job offers. So that's why Mayo Clinic HCE would love to support us. So they want to get a big number of those graduates from those programs. So that's the thing. Yes.
The intro of the show, every time we talk about healthcare, community, business, and life. And a lot of times they all overlap and intertwine. But I love this community. My kids live, I want them to grow up here. So I do have to plug Paul Sapia. He was on last week, HealthLink Jacks. Have you heard of HealthLink Jacks?
Of course.
Tied to that?
Of course.
I'm guessing.
All right.
Okay.
Yeah, of course. And we're partners with Paul and his company, Telescope Health, which is, greatly integrally involved with the HealthLink. And so we are providing actually research and staff support also on that project.
That's wonderful.
So, and y'all may know or not know, or you maybe he told you last time, Paul and I were students together at UNF around 2000. So we graduated together and we're in classes together. So, and I told him, well, you left UNF and became real successful. I came back and I'm still here.
You're still yeah, that's right.
Who had the better grades?
We won't compare that. The professor is now I give the grades.
So again, we talked a ton about the UNF Brooks College of Health. We'll probably touch on that a little bit on the second half too, but I think on the second half, as much as we can, talk about the International Healthcare Symposium, which is December 2nd and 3rd. Is that correct?
Yes, correct. Coming up soon.
Very soon. We'll dive into that, specific guests. Obviously, if there's more stuff we want to address in the second half, but that was that flew by. I told you 24 minutes goes pretty fast.
Yep.
That's what the hell just happened. Welcome back to the second half of What the Health Just Happened. If you're catching us on the radio and you missed the first half, good news is you can catch it on your favorite podcast platform under What the Health Just Happened. If you're on the podcast, we don't have commercials, at least not yet, until we can get some sponsors to pay for this thing, because I'm going broke paying I'm kidding. We love this show. We love doing it. First half, we talked a lot about the University of North Florida Brooks College of Health. SWOOP. We have 2 UNF graduates in the room. And we also have 2 representatives of UNF, the Director of Community Engagement, that's the title, and the Interim Dean, Brooks College of Health.
yes.
You ready for the second half?
Yes.
We're ready.
You remember the game Healthy or Not Healthy?
Sure.
Yes.
Healthy or not healthy, the number of emails you get during finals week to get out of finals.
Not helpful.
Healthy or not healthy, how much the Brooks College of Health is tied to the community of Jacksonville.
Healthy.
All right.
Healthy or not healthy, Coach Driscoll screaming, "Let's go."
Oh, let's go.
Very healthy.
I can't do it like
We
him,
all
though.
love him.
I don't know how he yells so much.
Oh, we all love him.
Healthy or not healthy, managing doctors.
Healthy.
I hear you're
Can
crying.
be healthy if you're trained at UNF and know how to do it.
Oh, swoop.
Healthy or not healthy, managing the faculty for the Brooks College of Health.
Very healthy. I got all the best faculty and staff in the world at Brooks College of Health UNF.
Healthy or not healthy, managing the budget for the Brooks College of Health.
I hope our president and provost are not listening to this.
Healthy or Not Healthy, the International Healthcare Symposium coming up on December 2nd and 3rd.
The most healthiest that you can be.
So swing away. What is it? Actually, let's start this. Who should be going to this? If someone hears this, like, I need to be at this event.
So I think basically it's directed at all healthcare providers, from physicians to nurses to ancillary care healthcare providers, anybody who's healthcare related, and also on the payer side, reimbursement, the insurance companies, the medical suppliers. So the medical supply companies, the medical electronics companies, because the topics are so diverse that anybody has anything to do with healthcare, even Eric Ross, who's doing this program, needs to be there. So because it's so good talking about healthcare as a total entity for all providers to get them to get on the table and come up with common solutions for the community. It's not directed at the general public, so if you're not really healthcare related, it probably won't find it. But we are doing a session this year which is very unique. Because business and healthcare, you talk about business and healthcare. So the Jacksonville Business Professionals is a relatively new organization. They've come up and got several hundred members now, and they're mostly small business owners. And their major concern going forward in their business is providing healthcare for their employees and themselves.
They could call 212 Benefits. That's what our company does.
Yeah, exactly. So I'm trying to create business for you here. So actually, we're going to have a panel session led by two JBP members, Jackson Business Professional members, Corey Jones and Ron Kirsch, and they're going to have several business owners talk about what are the common issues that they're dealing with on the healthcare side from a receiver side, if you will, rather than a provider side. So,
what would you add to that? Because I wrote some notes I'm going to read, but please add.
Yeah, and I also think that you mentioned physicians, nurses, therapists, and also I want to see healthcare leaders. We got a lot of the hospital CEOs, the insurance company CEOs will be there too. And I also want to mention that our fellow institution like FSCG, GU, I also want to invite their faculty to come to join us too.
And actually, several of them are speakers at our faculty from the other institutions.
It really is a great lineup. If you're in healthcare, I understand like a car dealership probably doesn't want to sit through a 2-day conference.
Unless they provide healthcare for their employees,
correct.
Which
like
they might come to that business session.
GE Healthcare, the VP of GE Healthcare will be there.
Right.
Yes.
Is someone from Medtronic going?
Yeah. So the senior VP from Medtronic, Kay Fellows, is going to be there. She's actually. Medtronic is the largest medical device company in the world.
Massive.
And we actually had the international CEO here 2 years ago.
Yes.
And so we had they're one of our great supporters, community partners. So one of their senior VPs I mentioned, Kay Fellows, will be there talking about what's going on new in health devices and artificial intelligence. So we can kind of give you a sneak preview of what we're going to talk about topic-wise at the Healthcare Symposium.
I'm going to read straight from their website what it is and just keep plugging this. December 2nd and 3rd, it was rescheduled from the last hurricane.
Yes, unfortunately.
But it opens the door for more people to come. This is directly from the website. The International Healthcare Symposium is a multidisciplinary conference aimed at educating, engaging, and connecting healthcare professionals in all disciplines through relevant sessions about challenging and opportunities in healthcare industry. That's a good one sentence there. But yes, please go ahead.
So this is our third year for the conference, and so we have specific kind of keynote topics we want to talk about. So our emphasis, as you know, everybody's talking about AI, ChatGPT, and so how does AI involve itself, or how has AI been used in healthcare? And that's one of our topics. So really, one of the other things we're going to talk about, really, the byline is personalized medicine in a changing digital environment. Digital includes AI. So how is healthcare being affected with all this new technology that's come about? And for us in healthcare, AI is not new. We've been using it for years. So although, this chat GPT came and made it general kind of everybody knows about it. Well, that's AI. Well, in healthcare, it's been around for a long time. So we're really taking it to the next level. And so we have the world's authorities talking about different areas of AI and digital health that's going to be used or being used, and what the future portends for healthcare.
I'm pretty sure my buddy, a free shout out, Matt Burseth with NLP Logics is on the panel.
Absolutely. He's on the digital health panel.
What were you going to add?
And I also want to add that, like Dr. Paryani mentioned, this is our third year to have this health symposium. The first year we had about 300 people participated. The second year we had about 600 people. So this year we're expecting another 600 people.
So it's already over 700 people.
Oh,
that's good.
So,
You sure you want me to go to this?
Yes.
yes. And
You're going to be on a great panel. So on social media panel, wellness and social media panel.
I wrote down most of the panelists, right? So topics including improving access to healthcare, huge topic.
Right.
Personalized healthcare, reimbursement and margin repair. Talk about the business side of healthcare.
Right.
Digital health and AI, health education in a digital age, wellness and social media, workforce development, nutrition and exercise.
Yes. And we also want to thank our partner for last year and this year, the Dual County Medical Society. So they are our partner for this one. So you can imagine we are going to have a big number of physicians from this area also be in this conference, this health symposium. So
I was going to say, go online. You can Google UNF International Healthcare Symposium. I didn't write down the website, but it's very easy to find.
Yeah,
Yes.
if you just put the healthcare symposium, it'll come up.
It is a great event. I went last year. A lot of big sponsors. You have the mayor speaking, the chief health officer for the city of Jax, the president of the Florida Medical Association, head of U.S. government affairs with GE Healthcare. Who's the president of the University of North Florida?
Dr. Lamayan.
Dr. Moaz Lamayan
will also be there. And he will actually open up with our keynote panel speakers of guests with our AMA representative, the FMA representative, the Dual County Medical President, and they're going to talk about how healthcare is being affected locally, statewide, and nationally.
I would just say if you are in Northeast Florida and you work in healthcare in any capacity, this is probably an event worth considering go to. If you don't live in Northeast Florida but can make it December 2nd and 3rd, I would recommend coming for this event because there's a lot of great speakers, a lot of great panels.
So we have people coming now from all the Southeast region and even nationally. So we have people flying in to attend the symposium. So it's great. So.
What topic are you most excited for? That's a tough question.
So I'm excited about Eric Ross talking about social media.
Oh gosh, really? Maybe like 5 minutes.
Somebody backed out. That he asked if I would join a panel conversation. I said, of course I will.
And I can also share with this group that Dr. Paryani is in charge of our Brooks College Health social media. And since he started 1 year and a half ago now, our rate increased significantly, 400 or even 600 increased.
Good.
Yeah.
So because he is posting everything almost every day, whatever important is happening at Brooks College Health, he is there. He's posting. So it's that fast, that good.
I have a love-hate relationship with social media, but the reality is, especially for students, like you have to have a presence, whatever platform that looks like.
Yes.
It's just how do you do it in a healthy way?
So I think, especially for health, it's LinkedIn. You know, there's other, obviously social media channels that are good also. But I think if you're going to advance in healthcare management and leadership, you have to be on LinkedIn because that's how you connect and network together. So it was interesting. I follow my graduates, and I've been at UNF since 2007. But my idea was to even go back since I'm an alumnus, to go back to my years and even before, and try to track all the alumni down. Well, it's so difficult to track people once they graduate because their emails change, address changes.
I still use my UNF email. I'm just kidding. I don't still use my UNF email.
Yeah, so, and the work email changes, you can't keep track. So what we've done is actually create a LinkedIn group. It's a private group, but it's all of our BCH alumni.
Oh, that's great.
So you join the alumni group, and then you can network, and that group is already over 700 people that we've been able to track down that are active. And the idea is, even if you change jobs, you're still going to have the LinkedIn account, right? So you're being able to see it and you'll get messages from us as all the events that happen on campus to keep you connected to UNF.
That to me is the healthy side of social, especially LinkedIn. We'll talk about LinkedIn specifically briefly, and then back to the symposium, the Brooks College of Health. But keeping those connections, and again, someone may be working at, I'll use Mayo as an example. This person that graduated from your program is working at Mayo, but secretly they're like, man, I kind of want to go work for Baptist. I'm not trying to throw anyone under the bus here, but those connections and relationships, you can confidently reach out to someone on LinkedIn and communicate via that platform.
Yeah, come back to your question. What is a section that would excite me the most for this health symposium? Dr. Paryani is excited about the social media where Erica be part of that. And I think I'm excited about this AI because we are all talking about AI, ChatGPT, and students are worried, are concerned, what if AI is going to take all our jobs? But in healthcare, I think, so that's why everybody's talking about the future healthcare is still the safe professional. We cannot, anything related to healthcare, related to our feelings, I think we are still the area that...
you cannot replace compassion.
Exactly.
Humans. Yeah.
Like robots may assist with surgeries and stuff, but at the end of the day, like healthcare will always need humans.
Yeah. Well, we have robots already, doing surgery.
Yeah, look at this robot right here, man. Check these moves out. Sorry.
And this robotic surgery, and actually one of the companies, Moon Surgical Robotics, is going to talk about what the new era of robotics is going to come in. The chief commercial officer is going to be speaking at the symposium. So we're going to talk about technology, how it's affecting healthcare. But the robot is not autonomous. So we are not there yet. And I don't know if we'll ever get there with healthcare because you still need the guidance for diagnosis and take care of, and the compassion you talk about, hold their hand after their surgery. Who's going to hold that hand, right? To make sure you're going to get well and get better. So it's going to make our task more efficient. And so it's even said, well, is robotics or AI going to replace healthcare workers? No, what it's going to replace is people who don't use AI. So the idea is if you're not really engaged in AI and using it efficiently, you're not going to be the healthcare provider that you need to be in the future. So our goal as UNF is to be the leaders in training our healthcare students to make sure they're correctly positioned in the community with all the knowledge and.
Can I apologize for doing that terrible robot dance? Can I take that?
That's pretty good.
But that's a very good point, Dr. Paryani. That's why UNF is adding the AI in healthcare and also AI in business AI. So we are adding several certificates. Each of the 5 colleges from UNF is adding an AI certificate. And Dr. Paryani serves on that university committee to make this happen.
Yeah, I'm on we have an AI council and Brooks College of Health, as well as all the other colleges at UNF have dedicated themselves that we're going to move AI forward in each of those areas for our students, so to make sure they're prepared. So not only in healthcare, but even in business and engineering and computer sciences. Every area you're going to need AI. So.
I'm looking at, again, you can go online to the website, see the schedule specifically. That one, Digital Health and AI, is at 11 a.m. on the 3rd. That's the Tuesday. I do see that old Dr. Thompson from Telescope is the moderator.
Yes. And he did a nice session with you at for the chamber a few weeks ago.
That was a good event.
Yeah.
What else about this event? I mean, that you want to talk about? You're excited about specific someone coming in town. You're like, I can't wait to meet this person or talk to him outside of just an email.
So I think we have several industry leaders that are going to talk about what's going on in the industry. Of course, we're going to talk about healthcare delivery at all levels. So we actually had the president of the AMA scheduled, but he had a conflict because of the hurricane thing. And so we actually had the chair of the board of trustees of the AMA coming and going to talk about at national level what's going on with AI and digital health. Again, I mentioned the FMA president, Lisa Cosgrove, will be here. She'll talk about what's going on at the state level. And then, our local Duval County Medical Society president, Dr. Ferdinand Formosa, is going to talk about what's going on at the local level in healthcare. So it really will be a very interesting, I believe, perspective on healthcare that you normally wouldn't get. If you go to a conference, you talk about, well, what's going on in one area. Mm-hmm. This is going to cut through all geographic, state lines, and technology. Technology does vary from place to place, and so this will give us an idea of what's going on everywhere in the country. and perhaps the world, because I think we are the leaders in AI here. So in healthcare. So I think we're going to have a really interesting discussion about this. So those leaders would be great. That session will be, I think, a must. And President Lamayam's going to moderate that, so he'll be really good at that because he can direct the conversation too. So we can,
I like to put these guys on the spot. Watch this. Do you know what AMA stands for?
American Medical Association.
There you go.
Wow.
Doing that.
Okay, Justin, what does FMA stand for?
Ooh, federal.
What state are you in?
Florida
Yes.
Medical Association.
There's so many There's so many acronyms thrown out in healthcare.
Yeah, sorry, we're kind of using the healthcare. We get into these abbreviations.
Yeah. So, what's something in the future for the Brooks College of Health that you're really excited about?
Well, good question, Eric. And I think we are in the process of developing several new programs. And one of those is that we just added called a Doctor of Health Administration program. Like we mentioned that we have the Bachelor of Healthcare Management program, Master of Health Science in Healthcare Informatics, EMH, the Executive Master of Health Administration program. Now we are adding the Doctor of Health Administration program. And several other ones we are going to discuss with the President and the Provost, including physician assistants.
PA program?
Yes.
Okay.
Yeah, because based on the market analysis and the local healthcare leaders' suggestions, PA is the top one program needed in this area. So again, we are going to discuss that. And several other programs and I think the audiology program. So I think we are developing several new programs.
So more programs in the works, all based off of that budget that you have to work on.
Yes.
What about you, community engagement? What's coming up that you're just thrilled about?
So my job is to spread the word.
Yeah.
So UNF, both of us being graduates, and I'm a Stanford graduate, so I always say I'm a Stanford graduate.
Let's go.
So the problem is UNF is not is a well-kept secret, right?
Yes.
And we don't want it to be a well-kept secret. So, and that's why I'm back here. I'm not at Stanford.
I love it.
I'm at UNF. So I'm here to spread the word that UNF is the best place to be to get education, especially in healthcare, since that's our area. But certainly for general education also, UNF is the place to be. And it's really it's been a well-kept secret. And so you talk about what's a win for me. Win is today, because I got word out to hundreds of your
millions.
Wow. Okay. International crowd that we're listening here.
Right.
So everybody that's been listening, so that we got the word out. And so that's a win for me. But the other thing is to make sure our community partners are engaged on a regular basis, so we know and we're listening to what their needs are, because the UNF is here to serve the community. So especially on our graduates, because you talk about what are our graduates looking for? Jobs. So if they don't know who they're connected with, and we don't know what jobs they're looking for, we can't connect them. So our goal is to have good partnerships, and not just talking partnership, but real partnerships where the students actually go out and do internships there, preceptors. They actually kind of interview for the job there, and they like them, they're going to keep them. So I think our idea is to keep the community partners engaged, and the more partners and more people we talk to in healthcare, the ideal world would be everybody who's involved in healthcare in Jacksonville will be engaged with UNF.
You said something I loved. It's like one of the best kept secrets. The University of North Florida. I say it all the time. It's the best college in the state of Florida.
Yes, sir.
But I think about some of my closest friendships, relationships. I always say, like, UNF. I grew up in South Florida, and people look at, where am I going to go? It's FAU's growing. It's UCF, USF, FSU, UF. University of North Florida. It's beautiful. It's not a massive university, which I like. Some people want that huge university experience, but I cannot compliment the school enough. I love it here. Everybody needs to enroll in the Brooks College of Health program at the University of North Florida.
Thank you so much.
I was going to ask you guys, do you almost feel lucky when you get to have these events because you get to showcase the school and the area as a whole?
Definitely.
Because I almost feel like we're spoiled. I mean, I don't know, you guys probably won't know this, but I lived up in Alexandria, Virginia before for like 12 years. And when I came back home, I'm like, we are so lucky here. From the landscape to the actual layout of the school. It's nice seeing the new gym. But do you guys almost feel lucky to showcase the school to these people?
Yes.
that are
I
flying
think
in?
most people don't realize how beautiful the campus it is. So, I've been a UF graduate and I've been a Stanford graduate. So I've been to all these other campuses. They're nice. So, but UNF is gorgeous.
Beautiful.
So it's
Yes.
the natural preserve that has been constructed around with a central campus. It's walkable pretty much all over. So it's really a beautiful campus and a beautiful asset for the community. Not to mention we have the beaches right
my
next door
gosh,
here, so
yes.
which most of the universities can't say.
Yeah.
So we really are in a great spot and a great campus. So it really is a local treasure. It really is.
You've been with UNF for how many years total?
Almost 21 years.
Oh,
21
nice.
years.
You've seen
Yes.
it change a ton.
So
Yes.
What are some changes over the last 21 years? Like, that was incredible.
Well, you can see the college. When I joined, we only had about 40 some buildings. Now we have more than 60 buildings.
Oh, wow.
So almost every year we add a new building, and that is amazing. And when my friend visits from Chicago, she said, May, in Chicago, in Illinois, we barely could see any new construction. And here, the moment when we landed, we were driving from the airport to the town center, we saw your building everywhere. So that alone already says the huge potential and growth of this area. And that also adds to the Brooks College Health. We need to provide the service, the healthcare services, to meet the needs of the community.
This is, we only got about 2 minutes left. What's something UNF doesn't have currently you think would be nice to have?
Ooh.
That's tough.
Not a football team. So.
I don't want a football team.
Yeah.
So I mean, there's a lot of talk about sports, but we really have great sports. So I think with the growth, we're going to need some more facilities
For athletics specifically?
For everything, we need more space for our collegiate. For our students, Brooks College of Health could use more space. We've actually got a campus off-site to help grow. May can talk about that. UNF MedNexus.
MedNex, the Deerwood campus.
Yeah, so maybe next time you could talk about that in a little more detail on what
talk
we do
about
over
a
there.
lot more UNF stuff.
Yeah,
in the future.
so
Yes.
and I think in general we're going to need more more support, financial support, and we hope we get that from not only the legislature, which we're mostly relied on, but also the community.
Yep.
The community is a huge part of our support, and that's why I say community engagement is a two-way street. We help the community, but the community also helps us. So it's really a two-way part. It's a true partnership. So
Open your checkbooks, Jacksonville.
Yeah, let's go.
We got to get that budget up for the Brooks College of Health.
Yeah, and we are here to welcome everybody to Brooks College of Health, University of North Florida.
Love it.
So here we are again. 24 minutes goes by so fast. But by the way, thank you for joining. I always ask this. Did you have fun?
Definitely, yes. We have
Would
a
you
lot
consider
of fun.
coming back?
Yes, definitely.
Yeah.
We want to come back.
it was almost as fun as a basketball game, but not quite.
Fair enough.
We'll see you at the
I like
basketball
that.
game. How's
Yes.
Not this Thursday, unfortunately.
that? Well, a future
I'll be
one.
at a bunch this
Future,
year.
yes.
Thank you for joining. Two representatives from the University of North Florida, the Director of Community Engagement, Dr. Paryani. I had to ask you 3 times to make sure I'm saying it correctly.
You got it perfect.
And the Interim Dean for the Brooks College of Health, Dr. Zhao. That's what the health just happened.
Thank you so much.